Hope Health Clinic originated in 1989 by some people at St. George's Church. They call themselves community ministries. I think the primary people behind this at that time were Reverend Stacy Sauls, who was the assistant rector here at St. George's, and Walter Jones Sr.
When we started this thing, and as I say, in 88, 89, there was a need for the kitchen and for the 5 loaves. There was a dire need for unemployed or uninsured or working poor. St. George's was at a stage in its life that it felt the need to be needed, but gosh, to say St. George's is not fair. It's just the whole community have just jumped on board. And
the physicians in Griffin who seemed to be involved at that time were Dr. James Skinner, who was a renowned OB/GYN doctor in Griffin. He was kind of the physician in charge of the original clinic. And Dr. David Van, who's still...
David Van. And David was a doctor for a while. And then certainly I can't fail to mention Tom Grayson. He did a magnificent job for some time.
Indicate that the first clinics were held down in the basement of St. George's Church and were manned by some volunteer physicians and nurses from the community. Renovations were made on the old Trailways bus station, which is directly across the street from St. George's, right across 10th Street, which the church had acquired. And renovations were made to this building to make a better facility for the clinic. It was dedicated to the memory of Dr. Denny Hall, who was a very beloved and well-known internist here in Griffin, who had died just a few years before that, and the clinic was dedicated in his memory.
I don't know, we couldn't be in business without the hospital trust, of course. But there, oh gosh, there have been so many private foundations and people that have given to this generously to this operation. Just real proud of our community to be as lively as and interested in giving.
And this is when Walter Jones Sr. Contracted with Mercer Medical School down in Macon, Georgia, to get some of their residents to come down and moonlight at the clinic on evenings. And they started by just moonlighting on one night a week. Some of my cohorts at internal medicine, Dr. Jerry Bone, Dr. David Hitson, Dr. Robert Hall helped me out, Dr. Arabeth Cohen, Dr. Valna Smith, and Dr. Tony Crump. So we came up with the idea of contracting with a physician to hire a nurse practitioner under his management to run the clinic, and have a nurse practitioner see patients under the management of a physician. We were able to obtain the services of Dr. David Hitson, who still remains the director of the medical clinic. And very luckily, at this time, he hired Susan Walter as the first nurse practitioner of the clinic. We were also able to hire Charlene Pierce as his nurse. And thank goodness for these two people, or all three of these people, because then the clinic really got off and going great guns. Susan Walter and Charlene Pierce were just absolutely perfect for the job. Their patients loved them, and the clinic began to grow by leaps and bounds.
I came to work full-time as a kind of a medical overseer of the nurse practitioners in the summer of 2000. The clinic had gone through a little bit of transition and had become a full-time clinic with full-time paid staff.
Well, primarily we saw chronic diseases, diabetes, hypertension, COPD, illnesses that go with that, infections, heart disease, strokes, so chronic diseases, and that's really what we focused on, was trying to focus on the chronic diseases and letting other entities that could handle other stuff in the area handle those things.
The major thrust of the clinic is to try to identify people with chronic medical problems, and in this area, metabolic syndrome is probably the biggest problem that we have in terms of the combination of hypertension and diabetes and cholesterol or triglyceride issues, obesity, and that disease process creates a lot of problems with stroke and heart attack. So, the vast majority of people we're seeing have metabolic syndrome and are treated for numerous medical problems. And
we've seen some really sick patients at the Hope Health Clinic. We've seen blood pressures over 300 for the top number, and over 200 for the bottom number.
Are at a point where if that continues, they're going to pop a blood vessel, maybe bleed in their brain and have a hemorrhagic stroke or a stroke, whether a blood vessel pops or not, a stroke nonetheless. And we've been able to see, introduce medications, get that pressure down dramatically and dramatically lower the incidence of stroke.
I'm sure to say that 80% of the patients that show up at the Hope Health Clinic who are in sad condition due to lack of medication or lack of diagnoses are success stories. And the emergency room used to be able to tell us that when we were closed, they could tell that we were closed because patients would end up coming over there.
Again, folks with large abscesses that come in and get drained and you get over the hump without hospitalization. Folks come in with an asthmatic attack and we initiate treatment with nebulizers and get them under control, and sometimes can keep them from having to go to the emergency room. But these things happen, every day.
The patient assistance program is a program that almost all pharmaceuticals have to assist patients with obtaining medication if their annual income is less than a certain amount. And if your annual income is less than a certain amount, then if you fill out these forms, you can get that medication in 3-month dosing. And but the paperwork can be very complicated to fill out, and keeping it up to date can be complicated. And it really requires staying on it all the time. The staff helps to keep them doing what they're supposed to do and bring in their information that they need so that the medicines can be ordered.
Treating them like a real person and not like, well, they don't have insurance or they don't have this kind of job or that kind of job, or sometimes they've had insurance like all their life, and now with the recent economy and stuff like that, and they've always had everything and now they don't, and so they feel so demeanored by all of this, and I'm so sorry I have to come. And that's what we're here for. We're here for you. This is why we're here.
During 2010, there was a movement between both the Griffin-Spalding Hospital Authority, the Spalding Regional Medical Center, and the 2 clinics that were in town. One of them was the Hope Health Clinic. One of them was the Spalding Medical Clinic, which was actually housed at the health department at that time. Through basically almost a year-long process, we went through the governance and all the other issues that were involved between the 2 clinics. And in January 1st of this year, actually, the 2 clinics were merged. At that time, they still were in 2 separate buildings because we didn't have our new building completed yet. The Spalding Medical Clinic remained in the health department, and there is a dental clinic also involved with that, and it remained in the health department until the building was completed in September of this year. The old Hope Health Clinic remained in its building until that time also.
In 1998, in collaboration with the Griffin-Spalding Hospital Authority, we began school nursing program in 4 of our schools, and at that time we identified many dental health needs that needed to be addressed. We began to work with the health department, collaborating with them as well as the hospital authority to identify what we could do to help with that dental health need among our schools and among our kids. As the program has developed over the years since that time, we've made great strides in the needs that we've been able to identify and meet.
Program that we have is the Dental for the Kids. It has just experienced amazing results. The numbers I've heard is when they initially screened, about 85% of children had some serious dental issues, and lately I've heard that's down to around 15%. So that's a major change there, and Denise is always pushing behind the scenes on that.
And I think that the Hope Health Clinic does a fine job of that, of meeting those needs, whether it be from the health perspective, the dental perspective, looking at the possibility of long-term being able to also meet the needs of those with Medicaid and Medicare down the road, because we don't know where things are going to go as a nation.
I think that there will always be a need for the kind of thing we provide. I think it's also incumbent upon us to look at the systems in place and what we feel like the systems are going to be to continue to make us viable in that area. And I think regardless of whether there's insurance or not, there's going to be a lot of people that are left out. We also are looking at the possibility of bringing Medicaid into our clinic. We feel that that's real important in the current health, what's going on in the healthcare business these days, because a lot of patients may have a doctor and they have Medicaid, but sometimes if that doctor fills up the number of Medicaid cases he can handle in 1 month, and that patient becomes sick after that, then the doctor is unable to see him. And we think by the way we're funded that we will be able to see more of those patients, and they'll have a patient home to come to, regardless of what time of the month it is or anything like that. We do hope to be a part of the community for a long, long time. We're constantly strategizing as to what we need to do as the new healthcare reform comes into play, particularly in 2014 when the brunt of that law will come into play. And we think we're in a good place to do that. Once again, I just want to give a lot of credit to the Griffin Spalding Hospital Authority. The Hospital Authority has been behind the Hope Health Clinic since day one. If it wasn't for the Hospital Authority, the clinic never would have moved across the street. They provided the money to remodel that building over there so that it could become a clinic, the old Greyhound bus building. And I can't say how much they've done for us this year as we moved into our new building.
The Hospital Authority has been huge in this. It's almost like they saw it the way we saw it to begin with. I mean, we've had to jump through some hoops. We're expected to do that. But for them to support us in the manner that they have is just unprecedented. I don't know of any other organization in any other county that has that opportunity. I think they came on board just at the right time, just when we bought these buildings and started renovating. I think that our new board membership had a lot to do with that overall, meaning we had a great group from the Spalding County Board and a great new group. It was a new group from Hope Health Board. I think that I'd like to name all those names, but everybody knows who they are. They all those guys. I think that sent them a signal that we really had a professional board. We do have a good board.
So that was the next question.
It was an effort between he and Dr. Grayson to bring in the needed funds. Somehow they found people to write grants for them, but it was working. Ever since Stacy Saul said you need to name it 5 loaves and 2 fish, and if you want a health clinic, start one. And I don't know, that was in the 80s somewhere. It has worked. The whole idea, including the soup kitchen, has worked. It's just it gives me and Harry the responsibility and the opportunity of making them all work together.
We figure that we serve about 4,500 people who have no insurance, but we also figure there probably are 14,000 in the county who have no insurance. So we've got a long way to go to get to everyone who could use our services, and we're trying very hard to do that.
Well, it's certainly been a privilege to, and gosh, look what who all we're going to involve in this thing as it grows. You know what? We're not kidding ourselves. This thing is going to have an impact on our little community. We're going to have healthier, happier people as a result of what we're capable of doing. And